Hi everyone, all of you must have heard a few things about steroids which gained popularity during the COVID times. So steroids are a very useful set of drugs when used carefully, that is in cases which require quick reduction of inflammation in the body. But steroids come with side effects like increase in blood pressure, blood sugar levels, fat deposition, formation of cataract in the eye and many more. So this leads to fear among the common public and thus steroids have gained a negative image in everybody's eyes. One great thing to know about sinusitis and nasal polyps is that their response to steroids is excellent. So these steroids can be used in doses which will be determined by your treating doctor. Out of the available options of how to use steroids, that is steroid nasal spray, tablets or injections, each has its role. The preferred method is using steroid sprays because they give excellent results and have very low side effects. These sprays will directly act in the sinuses and will stop polyp formation. But when to use steroids in tablet or injection form? Suppose there is a patient whose nose is full of polyps, then the steroid sprays are not very effective because there is no space for the spray to enter the sinuses because of the polyps. So in such cases, the steroid injections or tablets are preferred, although the side effects are definitely higher compared to the nasal sprays. But in many cases, we see that after giving the steroid multiple times, after a point of time, the polyps stop responding to steroids. We call this as steroid resistance. So in such cases, we need to do a sinus surgery and clear the polyps and the sinus disease, so that after the surgery there will be space for the steroid sprays to act and reduce further polyp formation. Even after surgery, regular follow-up is required and nasal endoscopy needs to be done regularly in the OPD. New polyp formation is quite common after surgery. These new polyps, if picked up early, can be managed easily on outpatient basis without any major surgery. So polyps are a major problem because repeated surgeries might be required and steroid medication might also be repeatedly required. Repeat surgery is not uncommon because many times patients stop the medication by themselves and stop coming for follow-ups once they start feeling better after the surgery.